As coronavirus was silently racing around the world in late January and early February, the federal government not only failed to use the massive arsenal of hundreds of laboratories across the United States for emergency testing, it actually left roadblocks in place to prevent non-government labs from assisting. That is according to documents obtained by CNN and interviews with more than a dozen scientists and physicians involved in coronavirus testing.
At the very beginning of this pandemic, it was the federal government that had the sole ability to do the testing and made it very difficult for private labs, for university labs to make their own tests based on certain regulatory hurdles.
Several hospital and university-based labs have told CNN they saw the pandemic approaching, were developing their own tests as early as January to detect the virus. But the red tape with the FDA's regulatory process prevented them from moving forward, meaning labs sat idle.
Rather than enlisting the tremendous strength and power of the U.S. laboratory capacity, getting everybody working on this and creating tests and having widespread test availability, we had CDC trying to keep running everything by itself.
The federal government was prepared to enforce the rules, sending this memo on February 6, telling state health departments to actively police against labs using their own coronavirus tests. The reasoning behind the tight regulations were good, assure the safety and efficacy of tests, but Dr. Glenn Morris of the University of Florida says the FDA rules were written for normal situations, not a crisis.
When we suddenly hit the point where we were looking at China and seeing what was going on there, what we needed was extremely aggressive leadership. We've got to move fast, because otherwise we're going to run into a problem.
The problem developed as soon as the CDC rolled out its own test for verification. It didn't work, and weeks were lost as the CDC scrambled to make a new test.
So we really were in a basically on a pause for a few weeks within the public health system. And meanwhile, the academic laboratories who had developed their own tests also were not able to test because the regulations didn't allow it at that time.
What's even worse, in 2018, after the Zika outbreak, the CDC came up with a plan to avoid the very testing disaster that's happening. CNN obtained a copy of this memorandum of understanding between the commercial and public labs and the CDC that was supposed to increase national laboratory testing in an emergency by engaging commercial labs early in the response. It didn't work. Dr. Karen Call, who runs the laboratory services for North Shore University Health System in Evanston, Illinois, was one of the labs pushing to launch its own test and was stopped by overbearing red tape.
It seems like this has been a bit of a failure.
I do think there's definitely room for improvement. And what's happened is we've had a number of laboratories and a number of manufacturers and groups that are not all working together in a coordinated fashion.
In a statement to CNN, the FDA insists there was nothing wrong in its process and instead blames individual lab delays where labs did not understand the FDA process and mistakenly believed there was more work involved. Despite that, the FDA did publish new guidelines on February 29th, allowing labs to begin testing. Experts tell CNN it was just too late. In a written response to CNN's questions, the CDC said it did keep laboratory communities up to date, informed on what was happening, but the CDC did not answer questions on why the agency didn't pursue those laboratories getting involved in this massive testing program sooner. Drew Griffin, CNN, Atlanta.